In this group, we have Chapter 9. We are going to be talking about casual comparative research. The three speakers will be myself, Regina Great, Michael Ward, and Zach Cochran. On the first slide, we are going to describe what is casual comparative research. Casual comparative research is treated as a type of descriptive research because it describes conditions that already exist. Casual comparative research attempts to describe reasons or cause for an existing condition. Casual comparative research is also called ex post facto research. Ex post facto is a Latin word that means after the fact or retrospect, because the researcher attempts to determine the cause for a pre-existing difference in a group of individuals. Casual comparative studies investigate variables that cannot or should not be investigated experimentally, facilitate decision-making, provide guidance for experimental studies, and are less costly. In casual comparative research, a researcher selects two groups of participants, the experimental and control groups, but more accurately referred to as a comparison group. Groups may differ in two ways. One group possesses a characteristic that the other does not, or each group has a characteristic but to differing degrees or amounts. Definition and selection of the comparison groups are very important parts of the casual comparative procedure. What types of questions will casual comparative research answer? There are three types of comparative research. They differ in their purpose and structure. They are exploration of effects, exploration of causes, and exploration of consequences. In type 1, exploration of effects, this question studies the dependent variable. What are the causes of being in a certain group? An example of this type of relationship was studied in the Army when they were considering allowing women in the infantry. They asked the question, what differences in abilities are caused by gender? In type 2, exploration of causes, it studies the independent variable. A question is, what variable causes people to be in a sorority, is an example. And finally, in type 3, exploration of consequences, this design studies the dependent variable of an intervention. An example is, how do students who are being homeschooled react to bullying?
What type of data collection is used in a casual comparative research? Data collection is used from matching, a comparison of homogeneous groups, a comparison of homogeneous subgroups, and an analysis of covariance. What type of data analysis is appropriate for casual comparative research? It has two different types that is appropriate. The first is descriptive statistics, which is a mean. It indicates the average performance of a group on a measure of some variable. And standard deviation, which indicates the spread of the scores around the mean. Another type of statistics is the inferential statistics. T-test is used to determine whether the scores of two groups are significantly different from one another. An analysis of variance used to test for significant differences among the scores for three or more groups, and a chi-square used to compare group frequencies. And the group frequencies are whether an event occurs more frequently in one group than another.
How do you ensure reliability and validity in casual comparative research? Reliability is the degree to which study data consistently measures whatever they measure. Reliability comes from in-depth research on several other studies as you compare, contrast the studies across cultures. How does internal and external validity pertain to causal comparative research? A major threat to the internal validity of a causal comparative study is the possibility of a subject selection bias. A researcher can reduce this threat by matching subjects on a related variable or creating homogeneous subgroups. Other threats to internal validity in causal comparative studies include location, instrumentation, and loss of subjects. This threat can be caused because of a lack of randomization and inability to manipulate an independent variable.
In the first article that we are going to discuss, it's the comparison of quality life, anxiety, and depression in children with cancer and healthy children in Iran. Cancer accounts for 4% of deaths in children under the 5 years of age and 13% of deaths in children aged between 5 to 15 years in Iran. Anxiety and depression occur simultaneously with cancer and brings about various adverse effects on one's personal and social life and physical health. And it also affects the disease treatment and progression. In this causal comparative study, the researchers aim to compare the quality of life, anxiety, and depression in children with cancer versus children without cancer. The people chosen to participate in the study consisted of children with cancer who were in the ages range 10 to 16, who were visiting the Mohammed Hospital based in Kermanshah, Iran in the summer of 2016. The healthy children were chosen from normal students in schools all across Kermanshah through a convenience sampling. The children in the study were given 3 tests. The 3 tests were the WHO Quality of Life. This is a questionnaire that was developed by the European Organization for Research and Treatment of Cancer. They were given the Children's Depression Scale. This is a 66-item scale that was developed in 1992 to assess the depression of children ages between 7 and 17 years old. And finally, they were given the Revised Children Manifest Anxiety Scale. This scale was developed in 1997 to assess the children's anxiety and included 37 yes and no questions. The study results show that children with cancer have different coping skills than kids who do not have cancer. The results also showed that children with cancer had a higher mean score for depression and anxiety than children who did not have cancer. It also showed that the quality of life for children with cancer was lower than that of children who are healthy. In conclusion, according to the results of the study, it can be concluded that emotional and behavioral changes are the strongest and most stable element that make a difference in cancer and healthy children.
Article 2, a comparative study on level and direction of aggression in high and low rejection sensitive adolescents. What is rejection sensitivity? Rejection sensitivity is a psychological condition which is characterized by sensitivity to rejection. Rejection sensitive persons expect others to reject them, readily interpret ambiguous interpersonal cues as rejection, and overreact to rejection or real or imagined. Individuals who suffer from rejection sensitivity also suffer from an abnormal amount of dread in situations where rejection is a possibility. Numerous studies show that child maltreatment places children and youth at risk for rejection sensitivity. Aim of the study: to explore the rejection sensitivity and levels as well as direction of aggression among adolescents and to compare whether high and low rejection sensitive children has any pattern in the direction of aggression. To check whether high and low rejection sensitive adolescents show any particular type of aggression pattern. Results: low rejection sensitive girls Girls with less sensitivity to rejection always want to protect their ego and show aggression to protect ego from external and internal threats. Low rejection sensitive boys show tendency to protect their ego or attempt to show a good image to others without showing their true aggressive responses to the situation. High rejection sensitive girls respond by protecting their ego in an aggressive manner. Their aggressiveness is directed to the environment and demand others for a solution of the problem or insisting that the problem be solved by the way they want. High rejection sensitive boys. Aggression is ego defensive. They avoid situations which could possibly threaten their ego. Conclusion: the low rejection sensitive boys and girls use ego defensive type of aggression. Low rejection sensitive girls direct their aggression to the environment, and low rejection sensitive boys direct their aggression by denying it.
Number 3, comparative study of parenting styles and parenting self-efficacy in mothers of children with and without anxiety symptoms. This study compared the relationships between parenting style and parenting self-efficacy in mothers of anxious and non-anxious children. Anxious refers to a feeling of unease or nervousness towards something with an unexpected outcome. The research design was there are 2 groups within the study. The case group, which consisted of 55 children diagnosed as anxious with their mothers, and the control group, 55 children with no diagnosis of being anxious with their mothers. Data collected from a child behavior checklist, which was a standardized form that parents fill out to describe their children's behavioral and emotional condition. A child parenting relationship scale, which was 30 questions of child-parent relationship, and the parent self-efficacy questionnaire, which assesses parent self-efficacy, were used to compare the 2 groups. The results of Article 3, the participants within the control group showed a higher level of responsiveness than the participants of the case group. The control group showed a higher level of accessibility than the case group, and the case group showed a higher level of conflict and confusion than the control group, and the control group compared to the case group showed a higher level of parenting self-efficacy. Article 3 conclusion is with a comparison of parenting styles and parenting self-efficacy of mothers with and without anxiety symptoms showed anxiety in children is strongly associated with parenting styles and parenting self-efficacy. Overall, parenting factors should be considered in the evaluation and treatment of preventing anxiety in children. And here are our references. And